Hello, everyone, and welcome. My name is Jennie Bever, and I'm the CEO of Fourth Trimester Arizona, a grassroots 501c3 collaborative of parents, families, health professionals, educators, and local organizations. We support the mental, physical, and emotional health of parents in the first 5 years after a baby is born. Thank you all for joining us today for our May 4th Trimester Ecosystem Lunchtime conversation about maternal mental health policy. For those of you who may be less familiar with Fourth Trimester Arizona, I'll begin with a brief introduction of our organization. We connect maternal and child healthcare providers, social support systems, and parent support groups to foster collaboration, education, and to increase access to local resources. Our programming includes 3 main focus areas: our monthly village meetups for new parents that happen 6 times a month at this point, our annual Fourth Trimester conference for both parents and professionals that happened last month, and our Fourth Trimester Ecosystem Initiative for all those who care for expectant and new families and their babies. The goal of the Fourth Trimester Ecosystem Initiative is to begin to have inclusive conversations about what is working and what needs to change to better support new families in Arizona. Today, our intention is to spend some time talking about the policy landscape as it impacts maternal mental health here in our state and nationally. We'll start with a speedy sampling of perspectives from our 4 guests, and then move into questions and discussion with the audience. Before we get started, we want to go over a few key items to ensure everyone is able to fully participate. During the presentations, please post all comments and questions in the chat box. We'll be monitoring the chat and responding to your comments and questions. Please remain muted except for when we open discussion. Of course, then please unmute and join. And we request that when we're in discussion that you enable your video if you're able. Of course, if you run into bandwidth issues, please turn off the cameras. And lastly, we'll be recording this session, so we're able to provide a recording after the session. I'd like to start with just a little background information on the state of maternal mental health here in our country and in Arizona. Thanks, Megan. We know that prior to the COVID-19 pandemic, perinatal depression impacted about 1 in 5 new mothers, and perinatal anxiety impacted around 30% of new mothers. During the COVID-19 pandemic, levels of perinatal anxiety and depression increased significantly. This data from this slide is actually from February to June of 2020, and it's actually the most recent data that I've seen taken. We also know that here in Arizona, around 25% of maternal death, which is death during pregnancy or 1 year after, around 25% of those deaths are contributing, mental health is a contributing factor. This data is actually from Arizona's maternal mortality report from 2020, which is based on 2016 and 2017 data. So maternal mental health is definitely having a big impact on maternal death in the pregnant and postpartum period. Maternal mental health issues also have negative impacts on child development. They impact child behavior, communication, mental health, and school performance. So this impacts not just the mother herself, but also her children. It's for this reason that 2020 Mom convened the Nonprofit Policy Fellows program, which Dr. English, Elizabeth Wood, and I are so proud to be part of, as it gave us quite a bit more knowledge and know-how to begin to look at policy issues in our state. And I have to admit that I wouldn't have known anything about the majority of this without that program. Some of you may know that earlier this month, May was officially declared Maternal Mental Health Month here in Arizona through a legislative resolution introduced by Representative Dr. Amish Shah. We were so pleased to be a part of that work, and we wanted to talk a little bit about that today, as well as give some perspective on where maternal mental health policy is going, the state and the national level. I'd like to start by introducing, sorry, that one's in the wrong place, but this is another piece I can talk about here. This was announced, I think, on Friday, that there is now an open hotline for maternal mental health. So this is a national hotline you can call from anywhere, and a hotline means somebody's going to pick up and it's free and confidential. And this just came on live. One of our village leads is actually a part of this hotline, and she wasn't allowed to say anything until Friday. But so this is a big piece of it, and we'll talk a little bit more about that as we move forward too. Thanks, Camille. So I'd like to start by introducing Cindy Herrik of 2020 Mom to talk about maternal mental health policy at the national level. Cindy serves as 2020 Mom Strategic Partnerships and National Campaigns Lead. She also runs the Maternal Suicide Awareness Campaign, as well as the Maternal Mental Health Week Awareness Campaign under 2020 Mom's awareness brand, the Blue Dot Project. Her own experience with severe maternal mental health disorders in 2012 sparked her desire to bring change to the maternal mental health care system, as well as work towards mainstreaming the discussion about maternal mental health. She lives here in Phoenix with her family. Thanks so much for being here with us today, Cindy. Could you tell us a little bit? Yeah, thank you so much. I'm so excited to have you, and that I got to see you in person last week.
Congratulations on all that hard work. Good job.
Yeah, thank you. Could you tell us a little bit about what's happening with maternal mental health policy at the national level?
Yeah, absolutely. Actually, the timing is perfect today because we are currently pushing out, or actually garnering support through our Twitter, which is 2020 at 2020 Mom Project. And I can drop the link there, but we're asking people to go there and support and retweet our latest bill, which is the Triumphs for Moms Mental Health Act. And that is actually we are asking for that to be included in the mental health package that they're looking over this weekend, which is the Restoring Hope for Mental Health and Wellbeing Act of 2022. Now, this is called the Triumph Act for Moms. And what it's asking them to do is to sort of streamline the process of maternal mental health on a federal level. We're asking them to develop a national maternal mental health strategy and recommendations for governors for implementation, and to identify the integration of maternal mental health, the identification and integration of maternal mental health in existing maternal, infant, and mental health activities, the elimination of duplicate activities, and also the gathering of maternal mental health stakeholder, and also garner public input and engagement. And so we're asking the public to go and help retweet and like that tweet, because we are trying to get this included into the mental health package. So that's going to be decided this weekend. So that's what we've been working on currently this last year. That is our, we've been championing this bill, which is, we think will be really great in sort of streamlining things and getting a federal task force for maternal mental health going.
That's very cool. So in order to get involved, we should go retweet from at 2020 Mom Project.
Yeah. And that it's pinned right there. And so we're really asking people to go show their support so that hopefully it'll be included.
That's very cool. Yeah. I know that some of the other work that 2020 Mom had been doing for years recently passed as well, right? Some of the maternal mental health legislation and the Momnibus stuff.
Yeah. Yes. There's been several, I'm just pulling up my notes here. There's so many. So yeah, the Triumph for New Moms Act is the current one, again, about maternal mental health coordination. I think it all started several years back with the Bringing Postpartum Depression Out of the Shadows Act. And that is actually our sister organization is MMHLA. They're applying for reauthorization of that, I believe. And then there's also the Moms Matter Act, which was to address maternal mental health equity.
Yeah, that's huge. I'm so glad to hear so much progress is being made. I know that 2020 Mom has been spearheading, and MMHLA spearheading this stuff for so long. So yes, yeah, Maternal Mental Health Leadership Alliance. Thanks, Elizabeth, for clarifying that. Yeah, that's another group to follow in addition to 2020 Mom when you're looking at this. Yeah, thank you.
Thanks, Elizabeth.
Yeah. Okay, so what we should do is definitely retweet that. Anything else we should be looking at on the national level?
Nope, that is currently our biggest project. So stay tuned, hopefully.
Yeah, I had the 2020 Mom made a letter, right, available to like click and send to your legislators. And so yeah, Cara and I were both saying that we got a message back today, which was pretty cool.
Thank you.
So that's another thing you can do as well.
Yep.
Awesome. Well, thank you so much, Cindy, for telling us about that and for all the work that you do to push this forward. I know that it's not a small thing, and it's a lot of time and energy, and it's amazing work. Really amazing.
For all that you guys do. Takes a village, right?
Yeah, absolutely. We're so glad that we have you.
Thank you.
All right. So now I'd like to introduce Heidi Christensen. Give me one sec. I think my husband's phone is ringing. Heidi's a master's level social worker and Arizona's Maternal Health Innovation Program Manager at the Arizona Department of Health Services. Heidi, among the many things you do, one of them is to convene the Maternal Mental Health Task Force. Could you tell us a little bit about that, when it started, who brings it together, and the goals?
Yeah, so to kind of give a little bit of a background super quick, our program started in the late, like just the last few months of 2019, so just before the pandemic. So that kind of, made our work go a little bit different than we initially thought it was going to. But one of the things that's exciting about it is that we got a bunch of federal funding for maternal health efforts. And my piece of that is working on intervention and prevention issues. But we knew we couldn't do that alone. And so one of the core things that we created was the Maternal Health Task Force, which the Maternal Mental Health Task Force is part of. So there's a larger body just looking over all issues surrounding maternal health. And then really what started the mental health piece was when we were looking at what we were missing in our action plan, there really wasn't very much surrounding mental health for the perinatal period. And really looking at who we had at the table, we didn't have very many mental health champions as part of that. And the few that we had are wonderful, and they're still involved to this day and our biggest supporters and do so much work in the community. So we were lucky to have them from the beginning and helping us with this work. But the task force is a diverse group of stakeholders. We try and get people from across the state because we know that we don't know everything. And it also includes people with lived experience, because that's really important. And when we're looking at how to make things better, you can't do it without the people who need the services. And one of the things, I come from a behavioral health background, and I really wanted to make sure that we added this to the work we were doing. So over the first year that they met, they developed priority areas around, so lots of activities, but the 4 areas were awareness. So things like, warning signs and stigma reduction around both substance use and maternal health issues, because, if you don't feel comfortable accessing services, you're not going to. And then training and education, that had kind of 2 components to it, more specialized training for the perinatal period for professionals, but also, what can we also give to birthing individuals and their support systems. Coverage is a big deal, because, we can't support systems if there's no payment for those things, ongoing, and a way to keep them going. But another part of that was looking not just at traditional systems, but the peer support models and traditional healers, because we know that those are models that work and that people seek out, and how do we include them in that system? And then access to care, that encompasses, again, lots of things. But one of the big issues for Arizona is we have 3 big urban areas that have a lot of providers, not nearly enough, but there is access in those areas. However, in our rural areas, both on the health side and mental health side, we just don't have the providers that we need. And so how do we get better access for everyone in the state? So those are all big things. And, this, as a state department, we can't personally work on policy, but that's the importance of this task force, is that we bring together lots of different people who can do different parts. We can do certain parts as the state agency, and our partners, can help us fulfill those other areas, because we know that policy is needed to get some of these things to move forward. So, and the ultimate goal is for all birthing individuals and their families to have equitable access to support and the care that they need. So, I think that it's exciting because that first year was a lot of hard work of just looking at what needed to change. And it's fun that this year we're starting to see some of that hard work really starting to pay off and things changing. So it's been exciting, and thank you for letting me share a little bit about it.
Yeah, thank you so much, Heidi. No, that's really
Mhm.
wonderful to hear, and to hear the background about that. And thank you for all that you do to support maternal health here in Arizona. It's huge. And I know that your work led to a huge increase in training and awareness around perinatal mental health last year with that PSI training, which we had so many Arizonans attend, which I think, yeah, I mean, it was a change maker. That's what it did. So yeah, I'm eager to see what else happens, because it's all going in positive direction. So thank you for all the work that you do and for being here today.
Thank you.
Mute myself. Next, I'd like to introduce Dr. Cara English. She's a doctor of behavioral health and the CEO of the Cummings Graduate Institute of Behavioral Health, and one of the nonprofit policy fellows with me. Cara, could you give us a little background on your experience and involvement with the nonprofit policy fellows, as well as tell us about some of the other policy issues we're working on here in Arizona?
Sure. Thank you, Dr. Bever. Great to be here today with so many of the lovely people. I get to do I would say the second job, which is mostly volunteer, and it's the small group of concerned citizens part of our world that we do together. It's exciting work, and I am just glad that I get to do it with you all. So the Nonprofit Policy Fellows cohort is something that is a lovely offering from the 2020 Mom organization. So from 2020 Mom, they have put together a policy cohort for both nonprofits and also for the government side of policymakers. And so it's really, I wouldn't call it necessarily a curriculum, but it's guidance from those who have gone before. And specifically in this policy fellows cohort, it's the 2020 Mom. I think she's the CEO. She might be the executive director. Cindy, please correct me either way. Joy Burkhart. And also Crystal McCauley. And so the 2020 Mom organization put together, as Dr. Bever was talking about, a policy fellows cohort. And so Jennie, and in representation of the Fourth Trimester Arizona Project, Elizabeth Wood as a representative of the Matrescence organization, and myself as a representative of Cummings Graduate Institute, which is a nonprofit education and training institute around integrated care. We all applied to participate, and the 2020 Mom organization said, how about let's have Fourth Trimester Arizona be the backbone organization, and the three of you learn and work together, which was fabulous for us because we already were working together. And so it gave us a way to come together and to learn policy and strategy from 2020 Mom, you know, and like you heard from Cindy, there's just so much being done to advance policy around making improvements in care and in support available for parents and for birthing individuals, especially related to mental health and substance abuse care, but also related to just the level of community infrastructure and systemic support for mothers and fathers. And so, you know, like Jennie mentioned, we've learned a lot. We were kind of reflecting on this yesterday about, you know, just how 2020 Mom's policy cohort has helped us. And one of the initial things that they had us do was just to look at how a bill can be tracked in your state. So that's not something that I had ever done before. I wasn't aware of where to go to look at a bill or how to find a bill related to keywords. I wasn't aware of how to identify the representatives of the bill or the sponsors of the bill, and then to look at how to sign on, or to, what is it called, Jennie, to speak for a bill?
Request to speak, I think.
Request to speak, which doesn't actually mean you speak. It just means that you're signing your name in support of a specific bill. And, you know, there's more information that can be shared on that. but every state is different. And so it was really kind of a homework assignment for us to go and learn that process in the state of Arizona, and for us locally as well. And so because of the network of the three of us and the who we knew, we learned how to get in touch with a couple of our representatives. And then we were able to schedule meetings with them to tell them about what we were trying to advance. 2020 Mom gave us some good guidance, some really valuable guidance about how to choose what to address with the representatives first, because it was more likely to gain support. And then once you get that momentum moving forward, how to say, okay, here's our action plan. And because this worked so well, we'd really love your support with this next step that we'd like to advance. So I think it really helped me as a clinician for over 20 years understand that without my personal involvement, because of my level of expertise in mental health as a clinician, and also my lived experience as both a mother and a provider in our state, you know, we can't really expect our lawmakers to understand what we want them to do. And it really is important for us to have that local level of action and participation, but I never knew how to do it effectively or strategically before. And so this policy fellows group and working with Jennie and Elizabeth throughout the process really helped. And it did take a while for me and my brain to really put it all together, because again, from a clinician standpoint, a workflow is very different than a policy workflow. So, you know, understanding how Arizona Department of Health Services and then Arizona Access, which is our Medicaid organization, and then understanding how our commercial insurance companies, and then understanding how the legislature and any of the bills, sometimes you need a bill to change policy, sometimes you don't, sometimes you just need support, or sometimes you just need a meeting. And so that was a real learning process for me. And it's something I wish every Arizonan, you know, especially every person in this group could get to know a little bit better, because there is a lot that we can actually do to impact change in the right direction based on what we know, you know, personally and professionally, and working together, that village, like Cindy referred to, and Jennie and Heidi, you know, it really made the village seem more powerful. So I hope I spoke to the points that you wanted me to talk about, but feel free to ask any questions or follow up.
Yeah, I think you did great, Cara. I agree. I think I just assumed I knew how things went until we actually started working in that space. And then it was like, oh, this is how things go. Oh, okay. And it required a lot more patience than I thought I was going to initially need.
Yeah. I also was surprised at how supportive and interested the people that we met with have been. I expected a lot more resistance, because at the clinical level, and you know, the way that I train my doctoral students is you're going to meet resistance because there's never enough funding, and you're asking them to make a change that usually means a change in funding, or asking or needing more money as an initial investment to get things moving. And it turned out that we actually had a lot of support, that, you know, folks at Access, folks in the legislature, they were already, you know, pointed in that direction. But what they needed was us to say, okay, well, this is one of the ways that we can get started rolling in that direction. And then we just keep working together. And the other thing was really that I think more change and more participation is really needed at the local level, even though the media often is very focused on national and federal politics. We really need to focus on the local level, because that's really, you know, what most of us are impacted by the most. But a lot of times we don't know that, because the media is just so focused on, you know, national news and federal kinds of politics. So, you know, learning that process was really important and very valuable.
Yeah, I agree. I totally agree. And it was pretty fun to hear the resolution read on the floor. I will say that part was the icing on the cake, maybe, of this particular aspect of what we did this year with the policy fellows. So yeah, well, thank you, Cara. Yes, I agree, and I think it was so useful to have your feedback and expertise as a mental health provider. I think that that was invaluable. I agree. That's a huge piece. Thank you so much. All right. So now I want to introduce Elizabeth Wood, who is the co-founder of Matrescence, fourth trimester planning and support, and a board member of Postpartum Support International's Arizona chapter. She also is a major contributor to the fourth trimester ecosystem. So I'm so happy to have her today and her support. And I don't know, I guess it's fellowship since we were part of the nonprofit policy fellows. I'm hoping, Elizabeth, you can tell us a little bit about your involvement with the nonprofit policy fellows and let viewers know some of the things they can do to become more aware of and get involved in policy.
Thanks, Jenny. Thanks so much. What a wonderful day to be part of. I share Jenny's beginning into this advocacy piece. All of this is really founded in 2020 Mom, not just because of this fellows, but honestly, the way that this started was ages ago. 2020 Mom had Mom Congress before COVID. And I was like, Jenny, let's go to this thing. And so somehow we ended up there. And that was really what began all of it, because I personally, and this is the message I want to send as loud and as clearly as possible today, is I knew nothing, like less than nothing about advocacy. And in 3 days, they trained me and Jenny up to be able to go with a cohort of people around the Capitol and advocate for maternal mental health. And so that was really the genesis for all of this that stands here today. And so if I can do this, if I can figure out how to make this work, then I think every single person here on the call can definitely do it. So I would love to take this from like a theoretical, this was a great policy fellows thing, into action of like, wait, what are some of these first steps that we can do? Because I feel like that was my biggest barrier, at least with all of this, is like, I don't know how to get involved. How do you even do this? So I've taken the liberty of putting a couple of links. I'm going to drop them in the chat. And don't be overwhelmed, because it's a menu, it's a buffet. You all can choose from what makes the most sense and what feels the best in your heart of how you might want to get involved in some advocacy work for maternal mental health. And so with that, first, Dr. Cara English was talking about like, how do I even find my legislator? Who is my legislator? And don't be embarrassed. That's where I was when I started this too. I don't think I could have named anyone in my district or beyond. And so you can actually go to the very first link, who are my representatives? And you can click on those, and that will take you to a page where you put in your address, and poof, you'll figure out who your representatives are. And then you can start to email them or connect with them. And one of the things that I wanted to share specifically on that was when we met with one of the representatives and we're talking about our actions moving forward and how we wanted to be bringing more awareness through the proclamation and to have policies changed to acknowledge maternal mental health as a specialty expertise, the legislator themselves told us, well, let's see how much we can do outside of policy, which we all chuckled. But the thing that was really cool is that legislator knew the people that were the decision makers that we need to have conversations with, and they convened the meeting for us to be able to have that specific experience. And so we were able to talk to some of those insurers with access and with the private insurers. And so I think that was surprising to me through this process too, is that just because politicians work with policy, it doesn't mean that they aren't also interested in trying to convene as many conversations that you can happen faster outside of the policy arena. That doesn't take as much of the partisanship lens. That was probably more long-winded than you needed, but if you can switch to the next slide about the maternal health bill tracker. So similar to Cindy saying, there's so much going on at the federal level. I'm the same way. I can't keep track of it. I don't know how to keep track of it all the time. And so ages ago, I bookmarked this specific, the second link I dropped in, the federal maternal bill tracker. And you can click there at any point, 24 hours a day, and it will show you all of the bills that are up at the federal level so that you have a better understanding if you want to do some research or you want to write a senator or somebody about them. So that's another great resource. The third one that I would say is we've already mentioned, but the MMHLA, which is the Maternal Mental Health Leadership Alliance. It's a great nonprofit. They have an advocacy toolkit. Again, it's like the ABCs. If you're not sure where to start with this, you can click on the link there and you can have the toolkit. And better yet, if you want what's going on in maternal mental health federally delivered to your inbox, you can just register for their newsletter. And there's a ton of information that can just be sent passively to you that you can read in your own time. The next one is Mom Congress, which I know Jennie is super excited to go to this, and she'll probably want to be hanging out with other Arizonans. So definitely let her know. But so that's going to be this year, September 18th, 20th. So this is the first time since COVID that it's happening back in person. It was a great experience, as I shared before, and definitely would encourage anyone that has the opportunity to go, because it really is a powerful experience. Like Dr. English said, it became readily aware just how much was needed for our voices, those with lived experience like myself with maternal mental health, to go and tell the stories to those representatives in the Capitol, because they have no idea. There's so much going on that unless we bring our attention to this issue, it's going to get steamrolled past with all the other things that are also up for important discussions. And then I think my last one is, how can you find the maternal health bills here in Arizona? So if you click on the link there, this is what Dr. English was saying was one of our first homework assignments from 2020 Moms Fellows group was, how do we even find these bills here in Arizona? So you can click in there, the word search on the left, you can see is kind of filled out that says maternal. You type in maternal and up will pop the bills. You'll see the very top one there is the proclamation that Jennie and Dr. English and Dr. Bever and I were all working on together. And so once you poke around in there, it becomes a little bit less cumbersome. It's still challenging, but definitely all of those things are great ways to just take your first step. What's your next first step? Did I miss one? Is there one more left in there or no? Oh, perfect. Yep. And so if all of this is still a little intimidating for you and you're like, I don't know about the advocacy piece, there's a local event here. There's one that's held in Phoenix and one that's in Northern Arizona, where you can just get in community and raise awareness around maternal mental health care and the needs that exist within our community. And through that community advocacy, that could be the best next step for you. So there's some links in there that you can see if you want to join a team. You don't have to fundraise. You literally can just show up and be with your people. So those I think are all that we have planned as far as ways to get involved. I think the only other mainline point, other than if I can do it, anyone can do it. The other piece of it was to tie into what Heidi was speaking about, the Department of Health Services, because it became really clear that, well, I didn't know that Department of Health can provide recommendations, but like she said, they can't advocate. And so joining or becoming familiar with what Jennie was presenting in the beginning, either the Maternal Mortality Review Committee or the Maternal Mental Health Task Force and the reports that are coming out of that, is that step for us as concerned citizens to become more informed and be able to advocate on behalf or inform the recommendations that the state is going to propose. Because there is a huge gap between their boundaries of what they're allowed to do and what they're not allowed to do. So that's another just main plug for, if you haven't considered it, just take one first step and give it a try and find people. So definitely email me, email Jennie, email Dr. Cara English. I'm sure I think all three of us have said multiple times, if it wasn't for us having a group of the three of us, this would have never happened because life's busy. So it was great that they picked things up when I had to drop them and vice versa. And I think that definitely, if you want to drop in the chat, if you're interested, if you're fired up and you want to get part of advocacy, put your name out there or just say you're interested. And I'm throwing this action to Jennie to follow up with those individuals to grow our force. Let's grow this community of concerned citizens to make shift happen. So that's all I got.
Thank you so much, Elizabeth. Yeah, thanks for all the background and the information. And I agree. I think that Mom Congress event was transformative. So I gotta give you huge props for nudging me to attend, because I think she said it and I was like, what is this? What are we doing? But like you said, it was so much easier together. And I think that was the power of that event, was just teaching us, oh, it's not that scary. This is something you can do, and it's something you're passionate about. So who better to be advocating for it than those who really are impacted and see what happens at the state level. So I want to also give you another option and maybe a sneak peek, I suppose, of how to begin to get involved. If you would like to, we will be hosting our statewide ecosystem summit again in September this year. Woohoo! And thank you to the Department of Health for providing us with a little bit of funding for that. It's huge. And one of the things we're going to talk about there is maternal health policy. We know that we have a lot of people locally who are very interested in mental health and in maternal health and in making change. And so that will be one of the things that we get to talk about, which I'm really excited about. Yeah, I know, I'm super excited too, Elizabeth. So at this point, we wanted to just take some time for questions and discussion. I think we'll start with questions and then we'll move into a little bit of discussion. We have plenty of time still. Yeah, thanks so much, Heidi. Camille, were there any questions that popped up in the chat at all? And everyone can feel free to just also unmute and ask questions as well if there are some that pop up.
Let me check.
Okay.
Not too many questions.
Okay. Yeah. Well, then anyone who would like to ask one, you're welcome to ask questions. We have a few minutes set aside for that.
Hi. Can you all hear me?
Yeah.
Yeah, okay. Hi, I'm Chanel. I'm a birth worker. I'm calling in from Phoenix, Arizona, but I'm a birth worker here and recently moved here from California. And I'm also working with the California Breastfeeding Coalition as our admin support. And so as of lately, there's been a lot of conversation around advocacy and a lot of like trainings around like advocacy education and what the legislative process has been like. And, you know, like a lot of you all have shared, like I have had no experience in this realm at all. And so it feels so in alignment to be here, just in this meeting, just hearing about just all of the opportunities that are happening here in Arizona. And I'm just so excited. And I also would like to know how I can be more involved. And yeah, so I guess I don't have a question, but I'm just really excited to be here. And I'm so excited by everyone else's passions and just really appreciate this space. So thank you.
Thank you. We're so excited to have you here. And I don't know if you know that breastfeeding is my other passion, but we probably should talk. Yeah. Thank you so much.
Yes.
Yep. Thank you so much. Yeah, I think I think that it's wonderful to see all the momentum around maternal mental health, around advocacy, around what we can do. That's been really, it's inspiring, right? Like it makes you want to keep moving when sometimes it feels like things are kind of getting stuck, especially during 2020, right? Yeah. Watching all of these things move forward really helps us, you know, believe that there are changes that can be made. So I'm so glad that you're here and that you're interested in being part of that. That's amazing. Any other questions or comments?
Just want to say, Chanel, you know, as far as getting involved, we definitely need you because, you know, that's one of the big things that, you know, Jennie mentioned about forming the coalition. That is something that came out of our work together in the Policy Fellows cohort. You know, we really were encouraged by the cohort to create a coalition aimed at policy advocacy and, you know, to continue the work of what we developed as an action plan. And we knew that, you know, between the three of us, we were putting together an action plan that represented our own lived experience and professional experience, but it doesn't represent, you know, everyone in Arizona. And that, you know, the larger thing we really wanted and needed was to bring together that larger group of citizens, you know. And so it's exciting to hear that you have some, you know, training and that you've been aware of some of the training and definitely coming from California because, you know, what you bring from California will be applicable here without a doubt. And so definitely come to the summit in September and, you know, just keep in touch with us. We'll be talking about opportunities, like Jennie said, you know, being Jennie's an IBCLC and, you know, just continuing to be connected with the fourth trimester ecosystem talks and with the village. That's one of the ways that I stay involved because I have a son who's 16 and, obviously I have a very busy job or several jobs, but this is kind of what I feel like is the consistent home for, coming together as a group. But also you could reach out to Heidi about the Maternal Mental Health Task Force. Heidi, do you want to talk about that? Just about opportunities to join the task force or be involved in the work?
Yeah, the mental health task force is always welcoming of new members to it, for sure. Just reach out. I'll put my contact information in the chat in just a second. But we're not just doing work just around mental health. That's probably one of my big passions and the piece that I really love. But there's a lot of other work that the state is doing around health in general. And so we have some other committees that are possible too. They're either being run through me or my coworker, Lynn Lane, so we can connect you to the right pieces. And she has done a lot of work around different types of breastfeeding support. In this last year, she did a lot of work around Indigenous breastfeeding courses and things like that. So if you're interested in any of that work, she's definitely a great resource too. So I'll put my information in, and yes, please, if anybody's interested, there's lots of ways to participate for as little as much as you want. The general task force, it only meets once a year, and it's kind of informational, and we give updates throughout the year. But so that one's a little less involved if you have a lot on your plate and can't quite do something that's more frequent. But then a lot of our other committees are quarterly. So kind of pick where you feel like you fit best. So thank you.
Thank you.
Exciting.
It
is so exciting. I just wanted to really just give Heidi and Clark and the whole team over at Department of Health Services. I didn't know anything about the Department of Health Services either before this got started, but we have such an amazing group of individuals who are willing to listen. They want to listen. And so, you kind of seem like there's like an iron curtain between us and the Department of Health, but in this case, it's truly not. So I definitely thank you, Heidi, for being there and doing that, and pass that on to your colleagues like Lynn and the rest too, please. And then the second thing I just wanted to say, as far as involvement, this was one of our big ahas, is a proclamation has to be passed every year. So if we're not aware of that, we're going to have to do this all again next year. So we definitely need support and help. Just think how amazing if we could have the amount of people at this growing and growing and growing every year. And we use this almost as like an event to mark the improvements that we are making. That would be remarkable. So yes, please, anyone that wants to be involved, we can always use your help because we'll get to do it every year.
Absolutely. Thanks so much for that, Elizabeth. And I couldn't agree more about the Department of Health and the wonderful people that are working there right now, including Heidi. Yeah, it's really just amazing to see the changes that are taking place.
Also, there's Kate Dobler. Kate, I see you in the group, but I don't know if you have the ability to use your microphone, but maybe talk a little bit about your work too.
Can you hear me? Okay, cool. Thank you. So yes, my name is Kate Dobler, and I work for Access, and I'm the state project director for the Arizona State Pilot Project for the treatment of pregnant and postpartum women with substance use disorder. Very long name, goes by PPWPLT. So those of you who are on the call, if you have heard of that name, that I'm the contact person for that. One of the components of the overall grant that I convene is a learning collaborative that is intended to connect and create space to connect people that are working directly with women who are in that space of being pregnant and postpartum and wanting to pursue treatment and recovery from substances, including opiates, and wanting to support the dyad of mom and baby to heal together, to recover and move through treatment together and stay together as a family. And so I I'm on my phone. So Jenny, whoever has the chat, if you can throw my email at access to in the chat, that would be great. The Learning Collaborative is an opportunity to create relationships with each other and to learn about who is doing what kind of work across the state and how can we learn from what works, how can we learn from what doesn't work so that we don't keep repeating the same mistakes. We have learned over the last year that in Arizona, we do a lot of really wonderful things with families that we don't necessarily share, and we are not necessarily aware of what is going on and what's happening. And so the Learning Collaborative is an opportunity to do that and to identify new ways to collaborate and partner to support moms. What else can I share? I am in awe with the policy level work that you three really have been able to do this year. I also am part of the work that Heidi is doing with Department of Health. I have the privilege of sitting on the Maternal Mortality Review Committee facilitated by Department of Health, along with Jennie and Cara and several other folks likely on the call and those who aren't. And it is really, I think it's really energizing and remarkable and phenomenal how much system level work has really begun to happen and how many connections have been made and fostered as we work to intentionally align our work across sectors and across agencies and across system partners so that we can meet women where they are with what they need. So that's the work I get to do. I love it. I am not a clinician. I'm not a provider, but I'm a systems builder. And really, what I enjoy most is being able to connect people that have not been connected before and figure out how to leverage all of the work that we're doing across the state to create better outcomes for moms and babies. Thanks, Cara. Yeah. And I'm open and would love to connect with anyone who wants to know more about this work, more about the Learning Collaborative, or if you are like, wow, how did I not know that this was going on? I had a great conversation today with Dr. Sarah Collier, who's the psychiatrist in the maternal perinatal mood disorder space. And she said to me, how did I not know that this was happening? How did I not know that there are echoes? What is an echo? How did I not know? So clearly we have work to do. We have partners to bring together. And so I would just offer the Learning Collaborative to other folks and other partners you work with who may not be connected to this collaborative intersected work that certainly we all do on this call. And feel free to connect folks or touch base with me to be a part of that work.
Mm-hmm.
Happy to answer any questions.
Thanks so
Thanks,
much.
Jenny.
Yeah, I'm so glad you're here. Yeah. That's such an amazing group that are all focused on improving maternal health here in our state. It's fun to be on a call with so many of you. So we have a few more minutes, about 9, it looks like. One of the questions that I wanted to ask is, and maybe this is something we kind of mull over as we begin to think about what we may want to talk about with policy at the summit. But one of the questions I wanted to ask are what policy issues are most impacting maternal mental health here in our state? And I think, I have an idea about a few of them, but I think that there are probably a lot more that I haven't noticed yet. I mean, Cara, I know you have pulled up some that I just had no idea were impacting maternal mental health policy, right? The fact that there isn't a specialty for perinatal mental health and how that impacts things. But I think that that's another piece. And since we're on the call, if anyone has one that they're thinking of, feel free to put it in the chat or, shout it out if you want. But that's definitely a piece of what we're going to be starting to think about is what places should we go next? How do we change things? Where should we guide our efforts?
To piggyback on what you said, Jennie, workforce development is a big issue, and that's why we were so lucky to be able to be the recipients of the grant. That Heidi's work was able to, infuse our state with the Postpartum Support International training. It was the 2-day training in perinatal mood and anxiety disorders, the advanced psychotherapy, and the advanced pharmacology training. And then in addition to that, pay for or scholarship a number of individuals to go and get the perinatal mental health certificate. So for those of you who aren't aware of what those are, the PMHC, or the Perinatal Mental Health Certificate, is from Postpartum Support International. It is a national certificate that identifies you as a provider who has gone through the training to become aware of what perinatal mood and anxiety disorders are, how to screen and assess for them, and what appropriate and culturally appropriate treatments are available and can be used from any perspective. So if whether you're a breastfeed, a lactation consultant or an IBCLC, a doula, a pregnancy or postpartum educator, a midwife, a behavioral health provider, an OB, a nurse practitioner, whatever your role is, it's really a good idea to be aware and have completed the training so that you're, just level setting your knowledge and, thorough understanding. A lot of people think, oh, I'm not a behavioral health provider, so maybe that training is not for me. But the truth is it's for everyone who is doing any kind of interaction with perinatal individuals, and is a really good idea to just, get that level of training. And then the certification, like Jennie mentioned, is really important because for providers in behavioral health who are trying to expand mental health care to families, and we have this specialized training to be able to really help families, we were being told and continue to be told by Access and by commercial insurers that they don't have any room on their provider panels for us because they have plenty of behavioral health providers. But this is a specialty, just like a medical specialty as a cardiologist, and access to having a cardiologist as a specialty. Similarly, families need access to the perinatal mental health specialty, as well as the perinatal psychopharmacology specialty. So for psychiatrists, not every moms who have gone to a pharmacist have been told, oh, you need to come off all of your medication, or have been given a lot of flack by a pharmacist for trying to fill a prescription for antidepressants because the pharmacist sees that they are a nursing mother or a pregnant person. And, that again leads to the stigma, and it hurts people who are, they need to have trust and faith in the medical health professionals who should be trained, but just aren't. And so thanks to the grant funding, we really expanded the training and education for providers in Arizona and prescribers in Arizona, which was huge. But those trainings are still available. And so PSI just announced today, they sent out an email for 2 trainings that are going to be available coming up on the 18th and 24th. They are free 90-minute webinars. It's a part 1 and part 2 on screening and assessment for BIPOC individuals, including, social determinants of health, racialized trauma, community supports, implicit bias, all kinds of really good information that most providers don't often get, especially when it comes to the perinatal population or just the BIPOC population in general. So those are 2 great trainings to look into. And you should be able to find those on the PSI Postpartum Support International website. And so I would highly recommend training and education in these areas too. And like Heidi is saying in the chat, if you're eligible to sit for the exam after you've had the training, we have 20 scholarships left for the certification exam. That's a $500 certification exam. And I still need to go and do it. I've already signed up and I've been approved. I just need to go and take the take the exam. And I know that there are groups in Arizona who are getting together to study, to prepare for taking the exam, but that's an important thing that you can do just to show families that you want to work with that you've done the training, that you are knowledgeable in this area. And it will eventually, because we're working on this in Arizona, it will eventually signal to Access and to commercial insurers that you have that specialty. And so that will make it even easier for families to find you and for you to be paid for the advanced level of training that you have to offer to families. So it shouldn't be complicated, but it just is. This is the reality of our healthcare system. So this is, part of why policy and provider and, industry government partnerships are so important.
Thanks so much, Cara. Yeah, I agree. Well, we only have a couple minutes left, so I want to just thank all of our speakers for today for all of the information and support and connections and encouragement that they gave everyone. I think that that's a big piece of it. I think that a lot of what I needed in this particular area was encouragement to keep going. So thank you for all of that. And thanks again to our Department of Health and Heidi for being here and for all the support that you give our state in terms of maternal mental health. I want to invite you to be at our next lunchtime conversation, which is Friday, July 1st from 12 to 1 on the same link, and also ask you to begin to save the date. It will likely be on a Friday, although we haven't quite set the date yet, for our statewide 4th Trimester Ecosystem Summit. I'm super excited to be able to get back to that, to have a full day of conversation around what this looks like, and we'll be convening our advisory board again soon. So if anyone is interested in being part of that as well, please let me know. All right, well, thank you, everyone. I want to give a big round of applause for our speakers. And thank you all for being here today and having conversations and contributing, and for all that you do for maternal health here in Arizona. I know that the people who are on this call, most of them are very well embedded in this area. So thank you for all the work that you do. All right.
Thanks, everybody. See you later.